Hello, this is Kenneth Reese, the founder, owner, and operator of WataugaOnline.com, and was certainly privileged to have Dr. Scott Elliott, superintendent of Watauga County Schools, with me again today. And Dr. Elliott has literally just came out of a Board of Education meeting that ended, as of this recording, about 40 minutes ago or so. We're recording this at almost 5 minutes after 4 o'clock on Monday. The big news that came out of the meeting today was moving forward with students coming back to school in person for Watauga County Schools. That will not be for all grades, but it will be for some. And Dr. Elliott can share with us the details of the vote that just occurred a little bit ago. Hello, Dr. Elliott. Been a long day for you. Thank you for your time today.
That's okay. We started with the weather and then ended with a school board meeting, but it's okay. It's good to see you, Kenneth.
Good to see you. And I should tell our audience real quick, when he says weather, Dr. Elliott's been up since 3 o'clock this morning, checking road conditions, and it was very slick this morning, and schools had to go on a remote day. So, and then the Board of Education meeting lasted about 2 hours. So it's been a long day. So anyway, my good man, I'll let you have the floor here.
Yeah, thank you. It's good to see you. So just to back up a little bit, I do want to remind people that students have been in school or having schooling all year long. I mean, we didn't start the year out with in-person instruction, with the exception of small numbers of some of our self-contained EC classes, our pre-K classes, and our mental health day treatment students. They've been coming in person since August, but our students and our teachers have been working really hard, even through remote instruction from August to October. In October, we transitioned to Plan B, the moderate social distancing of 6 feet of social distance for K2, then 3-5, then middle and high school. And that's where we've been ever since. So I want to begin by saying just how much I appreciate the hard work of our teachers, the cooperation and help of our parents, in making sure that we've been able to move smoothly through this school year, protecting our students in our schools. We haven't had to close a school. We haven't had to close a grade level. We haven't had clusters or outbreaks in our schools. We've been very successful in this slow and steady approach, but it is time, I think, and our board members agree as well, that it is now safe. And we've learned so much this school year about how to layer on these different mitigation strategies to protect our students and our staff members. It's time to start bringing our students back to school more days a week. Most children are coming 2 or 3 days a week. And as you said, the board voted today. So we want to run through that timeline just a little bit. The board's decision was to give parents 2 weeks notice. So 2 weeks from today, on Monday, March the 8th, our pre-K, kindergarten, first and second grade students will be coming 4 days a week, Monday, Tuesday, Thursday, and Friday. Then we'll have about 2 weeks to kind of get that operationalized and work through any bugs or challenges with transportation, contact tracing, moving classrooms around if we need to, cleaning protocols, lunch, cafeteria protocols. And then we will bring in the 3rd, 4th, and 5th grade students starting on Monday, March the 22nd. They'll be coming Monday, Tuesday, Thursday, Friday. So by the beginning of the week of that March the 22nd week, our K through 5 students will all be 4 days a week. What I also heard the board say is that they want to then evaluate bringing students in for 5 days a week. And they will discuss this again at their March 8th meeting. It could be that if things go smoothly over the next couple of weeks, that by the time students come back from spring break, that we are in a 5-day-a-week cycle for K5.
It's while we're talking about this, let me make a note right here to tell the viewer this. The board voted this afternoon, and it was unanimous, all 5 board members voting yes to this plan. It was not easy to get to this. The board members actually struggled a little bit on the motion of what to do or how to proceed to bring the children back, because it is an extremely complicated matter. It's also worth noting that when 3rd through 5th comes back on March the 22nd, or as the plan stands now, correct me if I'm wrong, that is a year and 2 days after schools were closed, March 20th, 2020.
Yeah, that it seems like
Yeah.
just yesterday.
In one way.
In one way and like 10 years ago in another. But yes, we received the word from the governor, I believe it was Saturday, March the 14th, that schools were going to be closed for, I think at that time, a 2-week period. We quickly met together as a staff, all of our principals and central services directors that Sunday afternoon, the next day. And we decided to take a week to give our teachers time to make the transition to remote instruction. And really, we've been at it ever since, including a summer program that we operated for some of our children back over the summer. The board, I would say, didn't struggle with this decision so much as they want to just make sure to get it right.
Yeah.
You notice that that there was some very thoughtful conversation. You could tell that from their comments that they've read a lot of research, they've consulted a lot of experts, they've been paying attention to the CDC guidance and all of the different studies. They have, you know, by asking me to collect information from them, from our local pediatricians and our health department and others, to get to the point where they felt comfortable that it was physically safe to
Mhm.
bring students back in greater numbers, because they've known for a long time the difficulties that our students are facing, many of them academically, socially, emotionally, psychologically, even physically, through being out of school as much as they have been. So you know, we have a very thoughtful board. This is probably the most experienced board in terms of their experience in our schools and in board service that I've worked with in my 7 years here. And I just appreciate that they have kept the focus on students. And at the same time, they wanting to make sure that we're doing everything we can to make this happen safely.
And thank you for clarifying my misphrasing of
Oh,
that. That's, I mean, you summed it up perfectly. And I will put a link to today's meeting in an article that I'll put out later, so folks can go back and watch the meeting. If you don't want to watch the whole 2 hours, you can skip through it. But there was a reason why that meeting was about 2 hours long.
right.
The other question, or it was over 2 hours long. The other question that folks will ask, and it is always worth reiterating, even if we touch on it a couple of times, there will be parents and guardians and others that say, okay, well, what about 6 through 12?
That's right.
That decision, again, is made by the governor's office. That is not anything local districts have control over yet. Um, there's, I don't even want to speculate on a timeline for that. We would all like for it to happen, but
Right. So what you heard in the board meeting today was interest from the board in how to move forward with more days of attendance for our middle school and high school students as well. The dream would be to end this school year, if not sooner, with students back in school 5 days a week. We just don't know if that's going to be feasible. We don't know if it's going to be allowable. And so just it's worth a moment for your viewers to understand that Plan A and Plan B have to do with the required minimal social distancing between students, not how many days a week children come to school. So we are currently restricted in middle school and high school to no more than Plan B, at least 6 feet of social distance. And like most of the school systems across the state who have implemented Plan B for middle and high school, we're doing it by bringing only half of our students back at a time so that we can maintain that social distance. There are other school systems, some of them very close to us, whose enrollment is so low that they can bring back all of the students that they have and keep them 6 feet apart. They're still
mhm.
operating in Plan B. So currently, the executive orders prevent that. We do know that Senate Bill 37, that our local senator, Senator Ballard, has worked hard to write, and sponsor, and negotiate, is also waiting for the governor's approval or his veto. We anticipate something about that is going to change this week. The governor has until the end of the week to decide to sign or to veto that bill. It would be difficult to speculate on that at this point, but I
Yeah.
don't think that the governor is prepared to sign it as written. In fact, he made a public statement about that last week. So I think that by the March 8th board meeting, we're going to know a lot more about what's allowable, and we will also begin this experience of the transition to the Plan A for the K-5 students. And another huge thing here that we haven't yet mentioned, but I know a lot of folks are excited about, and that's the vaccines for our teachers and our school staff members coming up this week on Wednesday.
Yeah, I definitely want to bring that up. Again, as you mentioned, the governor said in his press conference last week, he was asked by a reporter about that bill, and he was not totally happy with that bill. And like you said, by the end of this week, he either signs it, vetoes it, or does nothing. If he does nothing, it does go into law. And you said during the meeting, there's probably some behind the scenes negotiating, if you will, happening in Raleigh, as there is with all bills. So we'll just have to wait and see, especially with his press conference this week, how he's kind of leaning.
Right.
Let's talk about the vaccines real quick. I won't keep you long, and then we'll kind of recap again what the Board of Education did today. So talk about the vaccines. Big event coming up on Wednesday. Can you elaborate a little bit more on how Watauga County schools were able, and App Healthcare, were able to get this large dose of vaccines that will be available come Wednesday?
Well, it's a blessing.
Totally.
We've worked so
Totally.
hard. I'm sorry.
I said totally.
Totally a blessing. We've worked so hard to protect our staff members and to keep them healthy and at school so that we can provide this important service for our kids. As a school system, we've advocated at the state level, and also not so much advocated, but we're just there ready to be supportive of our local public health partners when the time came. We were so glad to see that the governor moved educators up at the front of Group 3. And we were glad that through some luck and divine intervention that our county was able to receive a significant increase in the allocation in the very week that teachers became eligible for it. Now, we've seen across the state that, especially in some of the smaller communities, that there has been enough vaccine in those communities that they've moved forward with some of their educators. But there are a lot of communities in this state that don't even have a plan yet or a schedule yet for vaccinating their teachers. I think the weather last week across most of the United States, unfortunately for those folks, but fortunately for us, played in our favor in terms of the timing of the shipment that came to us. Also, the county has been receiving 500 doses a week, but because they have been able to give and or administer all of those shots, the DHHS has seen that this county can do this and do this very effectively. They essentially doubled the allocation. So you have this large allocation that is coming that was delayed a week of about 3,000 doses that are going to be primarily dedicated to the 65 and older group, and then the 1,000 doses that are coming as part of the regular weekly allocation that are going to be allocated to school system employees and other childcare providers. What also helped is that we were ready to go. We had lists of our teachers signed up, organized by grade levels and numbers, and we were able to give all of that information to the health department starting this morning. Our teachers and employees of the school system, myself included, started getting those emails from the hospital and from the health department, scheduling those vaccines. So the two important dates, this Wednesday, all of our employees will be eligible to get the first shot. Then it is a Moderna shot, so we will wait 4 weeks to 4 weeks would be the middle of the week around March the 24th. But we know that second dose can sometimes have some significant side effects: fever, headaches, nausea, fatigue. So we are planning to have those shots on Friday, March the 26th, so that our teachers can have the weekend to rest and kind of recover. I mentioned that to you now, Kenneth, because I just want parents to mark that date on their calendars. Friday, March the 26th is likely to be either a remote day or an optional teacher work day for our students. And I hate that our kids will miss one more day of school, though by then many of them will be back by 4 days a week. But that is well worth it for one day to make sure that we're protecting our teachers.
And we say teachers, staff are involved too: cafeteria workers, bus drivers, anyone that signed up in January when you started to put that list together, correct?
That's exactly right. And you know what? They're all at risk. All of our employees work in our schools, from the guys in the maintenance department to our transportation folks who are working on the buses out at the schools but yes, we were afraid that with the small numbers of doses the county was receiving, that we would have to stagger in over time the school employees. So I can't say again, a blessing when Jen Green, the CEO and director of the local health department, App Healthcare, contacted me last week and said, based on the allocations, she thought that they would be able to provide a vaccine to every single one of our school system employees. And we couldn't be more excited about it.
That'll be incredible. And correct me if I'm wrong, but Watauga County School System will be the first one in the state to be able to do that for all of their staff and teachers. Is that right?
I heard that reported. Since we made our announcement, I think that other communities and health departments have also found that their allocations have gone up. So I've seen 2 or 3 other school systems that this week are also beginning. We're also fortunate that we, just the size of our district, and these districts that have thousands of employees, it's probably not likely that they're going to be able to get to all of their employees anytime soon. And I have to say again, my thanks to Jen Green, Chuck Mantooth with the hospital and others who really put this puzzle together and prioritized our teachers and school employees and really made it happen.
And we need to remind the viewer that it had been noted quite often by the state that their allotment of these vaccines were highly dependent on how many were given out, how many were wasted, because there have been waste. I mean, there's going to happen nationwide, unfortunately, but it was very key that these areas be able to distribute those. And that goes back to what Dr. Elliott was saying before about Watauga County has shown they can do it effectively. And that's why these extra vaccine allotments have become available. Very ironic that our school system that's affected by the weather, winter weather, is now going to be the recipient due to winter weather. How about the irony of that?
It's a little bit of good karma. We'll just take it.
It is. All right, we've only got just a few more seconds with you. Again, we'll recap. The Watauga County Board of Education voted today, Monday, February 22nd, that pre-K to second grade students go back 4 days a week starting March the 8th. That's in 2 weeks. Then third grade through fifth grade starting March the 22nd. And again, we will have to wait to see what the governor's office and NCDHHS decides about sixth graders through 12th graders. But for now, they will continue on the flex plan that we've all grown accustomed to since the fall.
That's right.
Anything else we need to touch on? That's a lot.
That was a lot. I always end these meetings by thanking our teachers. These educators are the heroes of this story, in my opinion, for showing up every day. And even with the limited schedule, just keeping the learning and the continuity going for our kids, and for being willing to do the work that it's going to take for the students to come back more. For our parents, thank you for your patience with us. But just for the whole community, I have to say again, that we've not reached we haven't crossed the finish line yet.
Right.
And now more than ever, because we're bringing more students back, we have to continue to be diligent. Mask wearing, minimizing our exposure outside of our home and non-family members, keeping kids home when they're sick. But we can do this. We can safely return our students to school if we continue to do all these things that have helped us get to where we are. We're in this together, and I'm just glad for our students that we're moving forward.
Well, I want to thank you for your time today. Again, Dr. Elliott's been up since 3 o'clock this morning, checking roads this morning, other meetings, had the Board of Education meeting, and then was gracious enough to join us here on WataugaOnline.com to talk about today's vote. Hopefully, we'll be able to get back together maybe within shorter than 2 weeks or so. We'll talk about how the first vaccines went. And then I want to talk about remote snow days. How have they gone? How successful have they been? What are we working on still? That's a conversation for another time. Thank you for your leadership. Thank you for everything you're doing for the Watauga County school system.
Thank you, Ken.
Dr. Scott Elliott, Superintendent of Watauga County Schools. I'm Kenneth Reese with WataugaOnline.com, and we'll talk to you soon. Stay safe out there, folks.